Hello, I'm Dr. Jessica Ailani. I'm the director of the MedStar Georgetown Headache Center and a professor of neurology at the MedStar Georgetown University Hospital in Washington, D.C. And I want to take this time and opportunity to invite all of you to the 4th annual International Congress of the Future of Neurology. This is a 2-day educational program that's going to be taking place September 23rd to the 24th in 2022. Join me and my colleagues as we discuss advances in the field and showcase the most recent advancements in neurological disorders. So, what are going to be the new topics that we're going to be discussing in the Future of Neurology conferences? We're going to really be talking about all of neurology and break it down into its subspecialties. And we have made sure that compared to the prior conferences in the past, that we are bringing you the most up-to-date information. We're well aware that neurology is moving at a pace faster than any one of us can keep up with. So we wanted to make sure in a nice, concise manner that we were able to bring you an update of what's been going on over the past few years in a digestible manner by the key opinion leaders through the United States. Bring them in to talk to you about what's happening in the field, how they're applying that kind of science in clinical practice. Because in the end, it doesn't really matter what the data shows, but how are we going to take that data and see patients and be able to use these tools in clinical practice? So we really focused on how can we make this information applicable to our clinicians. Other things that we have done that I think are really exciting, that I hope you guys are going to be excited to see, is that we find as participants of conferences ourselves, some of the most important and exciting types of conference material is when we have case-based and discussions, debate discussions between the different speakers on stage, and you take a very key topic like, hey, how are we going to use these new monoclonal antibodies in Alzheimer's treatments, the ones that the FDA barely passed through, that are super expensive? How do we decide who gets these treatments and how we're going to use them in clinical practice? And, how do we feel about these treatments in the field? And have a kind of conversation, debate occur amongst experts. I think that's a really fascinating type of conversation. These medical crossfires, which were occurring in the past conferences, maybe once a day, are now going to happen at least twice a day with different types of topics. So I'm really looking forward to those. I hope you as an audience member would be looking forward to it as well. And I think as an attendee, things that you can look forward to and really maximize your conference experience is to show up, absorb it all, and make sure you have questions that you arrive with. You take the opportunity to talk to the faculty. If you attend this virtually, you think of some questions that you can submit in advance. Really think about the issues you've been facing in clinical practice that you want to ask questions about, because that is what these meetings are about. We're back to networking again, and we're here to answer your questions. And so we are really looking forward to seeing you on September 23rd and the 24th at the 4th Annual International Congress on Future of Neurology.